Hello, good afternoon. My name is Toya. Today is July the 25th and the time is now 1:45. I'm here with Gloria, who's going to tell us a little bit about our life moving from the Caribbean to here in the UK. So could you please introduce yourself?
Hello, my name is Gloria. I am from Trinidad. Came up here in 1968. Went into nursing at Orchard Hospital in Thurrock. Been nursing for about 41 years. Lived in England for a number of years. Married, got 2 boys. Went back home, opened a nursing home for about 6 years. I left, came back here, and continued working as a district nurse. Stayed on for a little while, went back to Trinidad, and also went to a place called Anguilla. Did plastic surgery there for about 6 years, and retired, and now I'm back home in Trinidad.
I've spoken to your brother previously before, and your mom left from Trinidad to come here to the UK, and she started out as a surgical nurse before she went into midwifery.
Yes.
What was life like before you came to the UK, with your mom being here and you being with your siblings and your grandma?
I was looked after by my grandmother, and John was just 2 when Mom left. I more or less took him to school. I did everything because my grandmother was not a young person, and she also worked for a gentleman, doing household chores. And I had to do practically everything in the house. And yes, John, I more or less brought John until my mom brought me up. I came up on my own in 1968, went straight into Orchard Hospital, trained to be a nurse, and he came up and went with his mom, and just carried on from there with doing what's in training. Worked at Tilbury Hospital, worked at Orchard, then I went on the district, worked in different clinics. Yes, it's been all go.
Did you always wanted to be a nurse? Because I know normally John said he switched profession. Did you always wanted to be a nurse, or you wanted to do something else?
I wanted to be a vet because we had a lot of animals. I grew up among animals. I had rabbits. My mom had a monkey. We had chickens. We hatched chickens in the house. We had an incubator. We hatched chickens there, sold them. And I would have liked to be a vet if I wasn't a nurse. Also, I used to nurse the chickens and the dogs. Yeah, one over the other. Yeah, but when I came up here, it was I think my mom had it all planned for me to go into nursing, so that's what I did.
I know life back home, as you said, you had chickens and you had dogs and all of that, pets. How different was it being here in the UK when you didn't have any of those animals running?
Different, okay, so I didn't have the animals, but I really did not miss it, because going straight into nursing school, I mean, it was just studies and having to work as a pupil nurse or as a student, and it just carried on from there. Didn't miss. What I missed was the weather, because I came up more or less in the winter time, and it was cold. It was cold for me, very cold. But they provided us with these big capes, and yeah, with all the other West Indian girls, we we just carried on. Because I met girls from St. Vincent, girls from Trinidad, and we're still friends up to now. And the Irish and the English, into smoking and the thing, and I'm thinking, oh, women smoking, my grandmother would not allow that. Yeah, so. Yeah.
I know John spoke about the house was always filled with laughter, and people from all different places would come in. On the weekends, there's always a party going on. There's always people there. There's always somebody's coming up from the Caribbean. You just get a phone call. They're coming by you.
Mm-hmm.
How did you feel knowing that your house is always filled with someone? There's lots of love in the home. Did you feel sometimes that it's too much for you, or you just go with the flow?
I just go with the flow, because I had my 21st birthday here, and all the male nurses and female nurses and Trinidadians came, and we just had a big party. It's I didn't really, as I said, the only thing I missed was the weather. The sunshine. And then I did a lot of baking. I had to do a lot of baking. I had to do a lot of cooking, so I'm quite good at that.
So you didn't miss being back in Trinidad, because it's like a home away from home.
Yes,
you always have
yeah.
people around you, so you didn't quite miss much.
No, I didn't miss much, and I came up in early '68, and my grandmother passed away about 4 or 5 months after. So to me, that was the end of it. And then John came up, so yeah, home was now something of the past.
How did you integrate into society here? Because back home it's quite different. How did you integrate, and at any point did you feel as if you start questioning, did you make the right choice?
No, because I didn't have a choice. And when I came, I went straight into the nursing home, at the hospital, and where I met all these other girls, and we were all pursuing the same thing, studying together. Yes, it was, and we lived in one big nursing home, so it was okay. It was, meeting other different from different countries. Yes, it was. I didn't.
So you're saying meeting other girls from the Caribbean kind of help you to have that little bit of stability.
Yes.
And helping you to cope with the environment around you a bit more.
Yes, I would say so. And to be honest, I really didn't think about Trinidad at the time. I knew I missed my grandmother, and then, but Mom being here, I didn't feel that that's so alone, away from Trinidad. No. Because I met a few Trinidadians who came up around the same year, and I met them at the nursing home. So we all, gathered together.
When you went back home for holidays just to catch up with family, what was it like going back to a place where you've left for so many years? How did you cope with that new, basically it's like a new environment to you, because what you left back home has changed a bit.
It was strange because, one, I didn't have anywhere to go. I had to stay at friends. It was just, visited the places that I knew. It wasn't that strange, to be honest. I didn't feel left out. No. No, I didn't feel any way going back and think. You get into the fruits, like the mangoes and going to the river and all that sort of thing. And but other than that, actually I wanted to get back. Because one, I made so many friends, and Mom being here, I just wanted to get back. And I think by that time I had my 2 sons. So I at one time I took them home with me for a few years. One fitted in quite nicely, the other one hated the heat and he wanted to come back.
So you took them back just to have a little bit of experience of the Trinidadian culture.
Yeah. They loved it. They didn't have to wear all that clothes. And yes, they went in the river, they picked all the fruits. But one just couldn't deal with the heat. And still can't.
Your mom being the first back nurse in Thurrock, who basically she had to kind of fight her way, stand her ground to pursue her midwifery, because she started out as a surgical nurse. And when she wanted to change, she was telling no, she can't, and then she still went through with her decision and accomplished so many things. And how did you feel having your mom setting basically it's like she's paving the way for other female nurses to pursue their dream? How did you feel knowing that your mom did that and you're following in her footsteps?
Well, it was, proud of her that what she was doing. She was a midwife for 27 years. And she also had the lady who encouraged her, who we call Auntie Sybil. She's a Trinidadian, and she encouraged Mom to come up. And I did not like midwifery. Mom used to be out all night, sometimes in the rain, in the snow, for women who've gone into labor. I tried it for a few months, and I just did not like midwifery. But I admired what she was doing. But yeah. She loved it. she loved her midwifery. She used to get difficult patients to deal with that the doctors didn't want to handle at home, and yeah, she did very well. I think so. Yeah, it was not something that I liked, midwifery. I liked surgery. I was a surgical nurse in lots of places. Yeah. And in the meantime, I did aromatherapy, reflexology, beauty consultant. I did all those things in my spare time. So, yeah, I didn't. Yeah, it was good, for her to follow her dream. She did a good job of it. Yeah. She loved it. There's a lot of babies born around here, females, that are named Tina.
After your mom.
Yep. Yeah. And then she reached 100, so that a lot of people around here. I mean, she's been in this house 40 years. And we had houses specifically for nurses. We had for teachers and we had for policemen in the area. That is how they used to do it before. There's a plaque up there. That was on the door.
You can share it later.
When I spoke to your brother, he did say your mom was one who she encourages you to follow your dream.
Mm-hmm.
She didn't force you to do anything. She, whatever you wanted to
No.
do, she stand by
allowed,
you.
Yeah.
So would you say she did the same with you? Because I know sometimes boys, they're a little bit more lenient with boys than what they were with girls. So would you say you both get that same treatment with pursuing your dreams?
Yeah, I suppose so, yeah. I mean, when I as I said, when I came up, I went straight into the nursing home, and that was it. I mean, she didn't really force me to do anything, but she encouraged me to, she encouraged you to do whatever you want, to follow, as you say, follow your dreams, But, well, I don't know about John, but I mean, she didn't force me to do anything.
I know sometimes parents do find it hard, in a way, to tell their kids that they're proud of them. They are proud of their accomplishment. At any point did she say it to you? Sometimes they don't say it per se, but they show you in their actions. How did you know that she was really proud of your accomplishment?
Never said. I can't ever remember her saying anything. I just got on with it, and in her own way, she was probably, pleased I did such a thing. But I know when I got home, I opened a geriatric nursing home. And she came down and she helped me, strip wallpaper, helped me paint and all that. And I think she was quite pleased that I've done this, but to verbally say anything, no.
I know from the Caribbean myself, I know that your parents, they don't normally say it, but they show it in a very subtle way to show that they're proud of you. So I think probably coming down and helping you to accomplish is her way of saying
Yeah.
that they're proud of you, because they don't really show their emotions,
No.
and they never say to you, I love you or I'm proud of you, but they show it in actions. So would you say your mom actions show you how much she's proud of you?
Maybe when she came down to help me with the nursing home when I opened it. No, no. Never heard it verbally. And no, it's only when I had my 21st birthday that she organized a party and she was there, and you know but
So you could feel the love without she saying it.
for the 21st, yeah.
Yeah. How do you feel knowing that your mom had accomplished so many things and being the first person to accomplish it? How, when you found out that your mom was the first Black Caribbean person to be a midwife, and she went from being a sister to a matron, and then went on to do teaching.
Mm-hmm. Yeah, she taught a lot of pupil midwives, girls who wanted to be midwives. They was allocated to her, and she taught them. They went on to become midwives themselves. But I suppose, yes, that she got all these accolades. Yeah. The strange thing about it is that we lived like, because I went on, got married, moved out away from here, from around this area, and we were just mother and daughter business. It's nothing, as you say, it didn't show emotions, and yeah, it didn't. When she got she was honored by the mayoress of Thurrock. Yes, we were all there. It was good. Yeah, congratulated her and all that. But we, as a family, we never had that closeness. I think maybe as she left us behind, and then we came up and she was in her nursing, career, and I went into nursing away from the house. I think John might have been better off, because when he came, he was a little boy, so he stayed with her, went to school from here. I was already, I would say grown, and I just did my own thing. There wasn't that closeness, I should say.
Being a nurse here in the UK, what challenges did you face?
The only challenges I faced was when I was on the district. Some patients didn't like this coming to them. It got worse when Idi Amin threw the people out of Uganda. Few patients commented that, all these black people coming into the country, I don't know why they don't stay where they are, blah, 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 blah. And I said, do you want me to go? Oh, no, not you. You're different. Why am I different? Because I'm nursing you. But didn't see me as, a person as such. But yeah, that's the only time I got it. I didn't get anything during my training or anything. It's only when I got on the district I got that. And when he did throw them out in the 70s, yeah.
So, when you were in the district, at any point did you, because sometimes as a nurse, we question ourselves sometimes and ask, why are we here? Especially when you had a difficult patient.
Mm.
At any point in your career, did you question yourself to say if you made the right decision?
No. No. I enjoyed every minute of it.
Even the challenging side of stuff,
Yep. I just smiled. Yeah, I never had. I mean, what I used to get from, because I was the only, say, black nurse on the district. The other one was Irish, Welsh, I think 2 Irish and a Welsh. And they left me all the dirty cases, which I just went in, made patient a cup of tea. Are you going to make me a cup of tea? The others don't. They don't even stay that long. I said, of course I'll make you a cup of tea. And I said, well, why am I getting all these dirty patients? Patients with ulcers and all of that. And, well, because we have other things to do. I said, well, so have I. I've got other patients as well. But no, I just used to go in and smile. And that's it, do what I have to do. I had children as diabetics, and they had to have their insulin injection before going to school. And from the time they see my car coming up the road, they go on under the bed because they don't want to get injection. But after coaxing them, they got the insulin, off they went quite happy. Not really, And I mean, I stayed on there for 6-7 years on the district. And I had a wide area as well. Things. So, no, it was, I don't take on anybody, Regardless of who. I don't do stress. I don't do confrontation. I don't do, no.
You just go in, get your job done, and out you go.
Yep. Yeah. I mean, I went to Anguilla to work, as I say, with a plastic surgeon. And he didn't know me. I came from here. He interviewed me. And within a few days, he said to me, oh, I've got a work permit for you to come into the country and work. And I got in there, and within, must be 2 weeks, he was allowing me to do non-invasive cosmetic surgery. So, I mean, he just thought, oh, you've done so much and you've been here and there and done this. I want you like yesterday. So within a week, 2 weeks, he got my work permit and off I went. So I left here and I went to Anguilla. I stayed there 6 years. Beautiful place, beaches, the people, small island. Yep. As soon as I got there, the next day I got a car, and yeah.
So it's like you doing Windrush all over again.
Yes. Yeah.
Would you say growing up between the Caribbean and the UK and the experience that you've been through, would it say it helps you to be the person you are today?
Oh yes, definitely. Meeting all kinds of people here, then working in the Caribbean, and then going back home. Oh yes, yeah, it's made me a better person. As I say, I don't deal with, confrontation and all of that.
I know sometimes the challenges that we go through when we have kids, where kids in the UK lives are different from the ones in the Caribbean, and being from the Caribbean parents were really strict. And how did you navigate through, I don't know if your partner is British or he's from the Caribbean, I don't know if there's any culture clashes. How did you navigate through those things raising your kids?
Strict, like anybody else in the Caribbean. Very strict. Mom, you can remember when you hit me with a pot spoon and the Swiss stick? And how you used to pelt something? There across the room there? Don't do that. Mom, why it's because I used to pelt a lot of mangoes high up in the tree. That's just why I can pelt good.
I know sometimes kids here in the UK, and they try to push the boundaries. At any point did your kids try pushing the boundaries, or they knew that once mom says no, it's no?
Yep. I never deviated from the West Indian upbringing. Whether it was, they were born here, but no. If they needed slapping or if they needed, but although I had the social services at one point in time, you cannot hit your children. I said, who says? Because when they misbehave outside, what is going to happen? And I don't want that, so no. And they're good boys now. They're men. I think so. Yeah. People say to me, oh, they're so docile. Yeah. They probably going to school, they probably did things in the school, but at home, no. I was strict.
At any point did, because I know sometimes kids do come back to their parents and they do say, Mom, I am happy the way you brought us up, the morals that you've instilled in us, that help us to be the person that we are today. At any point did any of your boys say that to you?
No. But I see how they behave with their family. One has 2 children, wife. The other one has a partner, 1 child. No, they've never really said anything. I think we are not, I don't know if because of how we lived, we don't have that closeness and that bond, Maybe I brought them up too strict. I don't know.
I think the bond is there, but we don't really communicate it the way how we might see other people do it.
Yeah.
But I know that if, like, anything happen, they'll be there.
Oh yeah, because about 7 or 8 years ago, I got ill at home, was taken into hospital, and I had a friend from Canada, a school friend, was visiting, and she called them and she said, listen, look, your mom is in hospital or whatever, whatever. The next thing, the both of them got a flight and came home. Now one hates flying that long. He will not travel for more than about maybe 2 hours on a flight. The flight home is 8 hours, and the both of them came. Both of them came home.
So basically, they might not say it, but they do show it.
Yep. Yeah.
That's what I was saying, going back to Caribbeans, they don't really
Yes.
say it, but their actions speaks volume.
I mean, it's like I have a birthday coming up next month, and they both sat here and say, "Mom, we're going to have a barbecue." So they have organized to have a barbecue here on 2 Sundays from now in the back here. Oh, we'll provide the meat. Somebody going to lend one a barbecue that lives just around the corner, and yeah. So I would just sit back and just
Put
eat.
your feet up.
Yep, I would just eat what they cook.
So you'll be a little princess that day.
Oh yes, I don't know what. Let's go.
As you said, you're living now in Trinidad, right?
Yes.
For so many years here in the UK and living in different countries and exploring a lot of new things.
Mm-hmm.
Do you ever think you might return back to the UK and live?
The children wants me to do that because I live at home alone. Right? They're here. Mom is now gone. House is going to be no more. I went home after I retired and I was renting a house, and I thought, no, because I bought property at home with a house on it, and I think, no, I said I'm going back home. And I just packed my things up and went home. Went into the house and has, done a lot of renovations and additions and all that. And I'm quite comfortable. I come up here every year for Mom's birthday in January because my son is 27, she's 31st of January. I come up and it is cold by that time in January. I hate it. I can't deal with it anymore. So I can't see me coming back here to live. And if I come back, I have to live with one of the boys. I don't want to do that. They have their life to live, and yeah, they've got their family and they've got the things, so I wouldn't interrupt that. I'll stay at home and yeah.
At any point, did you ever consider doing teaching in nursing? All those experiences and knowledge that you've gained over the years, at any point did you consider going down the same field as your mom, end up teaching so that you could pass all your knowledges and experience to the upcoming nurses?
No, because things have changed so much, right? I mean, some of Mom's books I took to the library and they said, We don't want. Because they go in paperless, one, and that they have moved on from whatever, how we used to practice doing things. They have moved away from that. They have advanced themselves. So what I'll be teaching is what I know from since all those years ago, and they will look at me like, what am I talking about? The basic nursing has changed so much that I to teach these young girls coming up now would be a thing. I mean, one of my sons was born with what they call a clicky hip. And my mom used to put double diaper on him because you have to keep, because the hip, and you keep the leg apart. John's son was born with a clicky hip, and mom said, and he said, oh, that's old fashioned. So they went and they got a plaster of Paris, put him, and then put a bar between the legs to hold the legs apart. No, my son doesn't have any problem now with the double diapers. Just to keep the hip in place. It worked just as well then. So to teach anybody now would be, I would have to be updated and all my, procedures and all of that. No.
Would you say nursing then was more hands-on than what it is now?
Oh yes. Yeah.
Because would you say certain procedures that was done back when you were doing your nursing was more useful in per se than what it is now?
Oh yes, definitely. Because bathing the patient then to how they bath now is completely different. Oh no, we don't do that. We don't use that. As you say, it's more hands-on then than it is now. I see people going in, carers going into patients, and I time them.
2 minutes.
10 minutes. Oh yeah, and they're out back in their car. And I thought, well, what could you have done? But again, they have, I don't know who set up the time, but they've got limits to their time. Like when they used to come to mom. 10 minutes for tea break, 15 minutes at bedtime, 15 minutes in the morning. You can't wash a patient and dress them and give them breakfast within 15-20 minutes. So, yeah. When I go in, I would offer them, have you had breakfast? Have you had tea? I think, and they said no. And I said, well, my daughter will come just now. I said, but look at the time. So I will go and make a cup of tea. No, you're not getting that. No. They don't have the time because they've got so many people to look after.
But the way things are now with nursing, and would you have gone into nursing?
Yeah, I think so. As I say, it's either veterinary or nursing. I didn't have any other thing in mind. I look at a lot of animal programs on the TV and say, oh, look at the dog and look at what they're doing to the cat, and yeah, that sort of thing. So I'm still interested in that.
What would you say to someone who wants to pursue a career in nursing? What advice would you give them?
go for it if you like nursing, but you have to be wholly into it, you know. You can't just go in for nursing because of either the salary or the uniform or thing. You have to be, you know, real hands-on person and really care for your patients. Some of them just going for the glamour of it, for the uniform and the salary and things like that, but no. I was very good to my patients. I liked, you know, all kinds, whether they had ulcers on their feet or they had walking with a cane or whatever. Because I know at one point in time I'm going to get there. I know I like the same treatment. I think so. Yeah.
Could you tell us a little bit about your mom when she was a midwife?
I know she was out all hours of the day and night. Because as you know, you could go into labor at any point in time, and she was called out because at that time it was more babies were being born at home. Now you hardly hear babies being born at home. Everybody rushed into the hospital, and so yeah, that's all I can remember, her going out all hours of the night. And then not only that, you had to go and look after delivery. You still have to go back, I think must be 3-4 days after, and look after mother and baby. And because I didn't live, you know, that close to her, I mean, I just know that this is how it was. Even me, I went into hospital. I didn't, you know, she probably could have delivered me, but, you know, I went into hospital. That's, as I say, that's how I knew her, as being a midwife, and, you know, but, yeah. Because we didn't live that close. And I left home early. I mean, you know, I think as soon as I got qualified, I moved on. But I didn't live with her when I came. I didn't live with her at any point in time. I think so. I think John would be more know that, because he, as I say, he was a young boy and he was still at school, so he had to live at home with her.
Going to school in the Caribbean and going to school here in the UK, and although you went to nursing school, you came up and you went straight into nursing. At any point did you, because I know teachers, doesn't matter, school is school, at any point did you look at the way they taught you here in the UK from the way you were taught in the Caribbean? It was like, it's quite difficult, or it's quite demanding in any way?
Going to school in Trinidad was, because I went to a convent school where the nuns were teachers and the principal, Irish nuns. Wicked. And I had to travel on 3 different transport to get to school. They were very strict. And they were, how I call them? We had to be in a Catholic school. We had to go to Mass every Monday, walk to the church. Then, of course, it was the First Communion, then it was confirmation and graduation, and it was all under the nuns, how they wanted it. Here, as I see graduation, you wear all these fancy clothes and all that. We had to wear a particular white dress, all made the same. They were strict as well, but there were a couple of teachers, because I know my mom wasn't with me, that taught me a lot, and took me under their wings. There were 2 teachers that particularly took me under their wings, and it was okay. It was, how to dress, how to comb my hair, because I had thick, long hair, and my grandmother could deal with it. And they were quite good. Put me into the domestic science, which taught me how to cook. They were good. But it was rough going to do all this traveling. 3 sets of transport to get to the school. Take a taxi or thing, then take the train, then take a trolley bus, and so, but I got through. I might not have gotten through with a lot of passes, but yeah.
Do you want to take a break?
Yeah.
Let her take a break. Okay. And we're back. Could you just summarize what your experience is from the Caribbean to the UK to the countries that you've been, and now you're back here, and that's just basically it.
My experiences, having lived here, doing my training, it was good. Went back home, opened my own nursing home. That was okay. Left, came back here, worked. Went to Angola, did some plastic surgery, not on myself, but on other people. Retired from there, went back to Trinidad, living there now, and I'm comfortable. I am okay. Got my own place, and I'm back now because of my mom's passing at 100, and here now, sorting out the house, and that's it. Going to have a birthday next month on the 7th of August. I'm not going to say how old I'm going to be, because I'm real old.
16.
And yes, just now waiting for things to be sorted out, and then I'm going back home.
That's it? Yeah.
That's it. Thank you so much, and I appreciate
You're
it.
welcome.